holding on.
This is Emerson. He's like any other 2-year-old, energetic, playful, and curious. Except there's something that makes him different.
In August 2016, Emerson was diagnosed with a cyst on his spine, level C6, C7, which is quite high up, which basically meant that Emerson, after surgery, he became paralysed from the chest down.
Emerson's spinal cord injury turned his family's life upside down.
It's hard because as a parent you want to grieve that, you know, my child's no longer walking. He had a really active life before.
Earlier this year, Emerson had a seizure in the middle of the night. When his parents came into his bedroom, the room was a normal temperature, but Emerson was freezing cold.
Can I have a kissy?
Emerson's parents now wake up every 3 hours to check their son's temperature and to rotate his sleeping position, something he can't do himself.
If we had an app that actually said, you know, his temperature's dropped, so we need to then just, you know, come into his room, just check that everything's okay.
The app could give you peace of mind in the middle of the night.
Yeah, definitely. And then it would allow us to have, you know, a couple of hours sleep.
Right.
Yeah.
So we're going to go into a hackathon. This is hosted by IBM here in the UK. Basically, it's a bunch of people competing to see who can build the best app to help Emerson and his family. How's it going?
We're just working on an app to help monitor Emerson.
We want a solution that will grow with him as he grows older.
What we've put together is a dashboard that will be mounted on Emerson's wheelchair in the form of an iPad.
The winning team's design would provide real-time updates on Emerson's temperature, sweat levels, and heart rate. The app would send out alerts to Emerson's family or teachers if something is wrong.
The idea is that the data is in such a digestible, easy-to-use form that if there is something going wrong, then anybody around Emerson can quickly see that and then knows exactly what to do.
IBM is among a growing number of big tech companies investing in digital health. Research shows apps are the fastest growing sector in the digital health market, and the UK mobile health app market is expected to reach £250 million, or more than $300 million, next year, a growth rate of 35% since 2014.
We say we're a bit more than an app, we're more like a digital service.
Chris Edson is the CEO of RPath, a digital health startup in London that helps prevent diabetes.
We started the program mainly for diabetes prevention, so helping people get out of the risk zone. But then we soon realized that even people with diabetes can really benefit from that kind of lifestyle change program.
For about $250, RPath users receive a fitness tracker, a smart scale, and an app to monitor their eating, sleeping, and activity habits. They receive personalized advice from the company's dietitians and take part in an online community. Users in the 3-month program have seen sustained weight loss of around 18 pounds, reducing their risk of diabetes by 70%. The company just partnered with the UK's National Health Service, where it will take on an additional 1,000 patients, more than twice its current user base.
Do the people who use it come back to you and say, this has given me that higher quality of life that I was looking for?
Yeah, the feedback from people on the program is the most amazing thing. Hearing people just email us and say, this has changed my life.
The app from the hackathon is being developed, and Emerson's family says they hope to have it when Emerson goes to nursery next year.
Emerson has complex needs, but they're needs that shouldn't stop him from being a normal 2-year-old or a normal child. Arms up in there. Emerson every day brings joy into our hearts. He smiles, he's got a cheeky character, he stays so positive. He gets us through our days.